Thank you, Chair and members. I also want to take the opportunity to thank the committee for working on this bill with my staff. Medi-Cal was enacted in 1966 to provide medical services for our children and adults with limited income and resources. In the most recent data released in November of 2023, it was reported that nearly 15 million Californians are enrolled in Medi-Cal and around 38% of the state's population. When transporting a Medi-Cal patient, private ambulances are paid through an established and set rate, roughly $110 per transportation. This rate has not been increased since 1999. It's estimated that the private ambulance providers lose $165 million annually due to below-cost reimbursement rates set by Medi-Cal program. AB 1328 would require the Medi-Cal for service reimbursement rates for non-emergency ambulance transports and for interfacility ambulance transports to be 100% of the amount set forth in the federal Medicare ambulance fee schedule for the appropriate level of service billed. To ensure that Medi-Cal patients can receive the transports they often desperately need, AB 1328 aims to raise the reimbursement rate for an industry that has been hurting for over 2 decades. To testify here today, I have Sean Sullivan, CEO of Life West Ambulance, and Dr. David Duncan, former director of CalIMSA.
Thanks. You'll each have 2 minutes.
Thank you, Madam Chair. Thank you, members of the Health Committee. My name is Sean Sullivan. I am an EMT. I'm a leader of a regional ambulance service, and I also am on the board of directors with the California Ambulance Association. Our association represents about 3/4 of the licensed ambulances in the state of California, and tens of thousands of EMTs, paramedics, and nurses. As Assemblywoman had shared, the services that we provide are critical, but we also do work with evacuations. So recently in the fires that happened down south, all of those evacuations were performed by private ambulance services, as municipal providers are often dealing with 911 emergencies or fire suppression. There are 2 basic ambulance services, 911 services, which I think everybody's familiar with when you call 911 and ambulance responds, and there's interfacility ambulance services, and that is moving patients in between healthcare facilities and hospitals. And as our healthcare has evolved and developed, that is more and more important each day, as there are specialty care centers, as there are reasons to move patients between those 2 facilities. As was shared, our funding, unfortunately, has not been addressed in a long time. And unlike our emergency 911 counterparts who have seen funding enhancements in the last couple of years, we unfortunately have not. So that is why we're here today in support of this bill. Dr. Duncan is going to talk about the impact to patients. I really want to focus on the impact to providers. Many EMTs go on to become paramedics and nurses and physicians and actually work in the state assembly. And so it's an important place for people to enter the profession of healthcare and of leadership. And as we are today with the funding that we don't have, we're not able to pay a wage that is commensurate with somebody who does the work. Clearly, labor represents the majority of our costs, and so this is a significant opportunity for us.
Thank you.
Good afternoon, Madam Chair and Assembly. I'm Dr. Dave Duncan. I've been an emergency physician for more than 30 years, and I was the prior director of the State EMS Authority for California. During my tenure as an emergency physician and director, I've had the pleasure of managing thousands of these interfacility, or as we call IFT type patients throughout California. I can affirm these patients are the most complex and resource-intensive patients that we see in our small emergency departments throughout the state. And I'd like to offer a few key takeaways as we move forward and think about this and the impact. One, we can't take care of these patients in small emergency departments. They have to be transferred to definitive care in larger hospitals with appropriate resources. Oddly, this IFT space falls outside of the 911 system. When we call 911, we get an ambulance. If I, as an emergency physician, call for an IFT in my emergency department, I may or may not get a transport for these patients timely or at all. This leaves a huge gap in care. This IFT space is not reimbursed appropriately. It hasn't, as mentioned, had an increase in rates since the late 90s. The costs don't even cover the cost of the transport to move the patient. That said, these patients get stuck in small emergency departments. We can't move them out. That's detrimental to the entire healthcare system in these small rural spaces. We're stuck with patients. It impacts the emergency departments, decreases access to emergency and hospital care, and it ends up increasing the risk of these hospital systems for failure and closure as they're already at markedly increased risk. So thank you for your consideration.
Thank you. Are there any others in support of this bill? Please come forward and state your name, affiliation, and position on the bill.
Hello, my name is Grady. I work for Pro Transport One, and I support this bill.
Hello, my name is Matt Burrell. I'm the Chief Operations Officer of Alpha One in Sacramento, and I fully support this bill.
Good afternoon, James Pearson, President CEO of Medic Ambulance Service, and we support this bill.
Hello, Ramit Sahi, Executive Vice President, NorCal Ambulance, and I support this bill.
My name is Nick Koibian, Lead Supervisor, Alpha One Ambulance, and I support this bill.
Eddie Stamp, Regional Account Manager, NorCal Ambulance, I support this bill.
Alistair Lavin with NorCal Ambulance, and I support this bill.
Alexander Armendariz. I'm a communications manager, and I support this bill with NorCal Ambulance.
My name is Nick Scher. I'm a station manager with NorCal Ambulance. I support this bill.
My name is Joshua Lovejoy with American Ambulance of Visalia. I'm the operations manager, and I support this bill.
My name is Eve Price. I'm operations manager with American Ambulance of Visalia, and I support this bill.
Tim Madden, representing the California chapter of the American College of Emergency Physicians, in support.
Mike Dowd, Operations Supervisor for Medic Ambulance Sacramento, and I support this bill.
Lisa Curley, Operations Manager for Medic Ambulance Sacramento, and I support this bill.
I'm Steve Grau. I'm President-elect of California Ambulance Association, and I support this bill.
Any primary witnesses in opposition to the bill? Please come forward. Any Me Too's in opposition to the bill? Seeing none, I'll bring it back to the committee for question or comment. This bill has been moved and seconded. Assembly member, I want to thank you. I also want to clarify that you are taking the amendments to apply rate increase to Medi-Cal managed care plans.
Yes.
Thank you. And I want to note that Medi-Cal rates in this area are much, much lower than Medicare, and an increase here seems long overdue. I want to thank you for being such a champion for our first responders in this way. Please close.
Thank you, and I respectfully ask for an aye vote.
Thank you. Please call roll.
The motion is due pass as amended to appropriations. Bonta?
Aye.
Bonta, aye. Chen?
Aye.
Chen, aye. Addis? Aguiar Curry? Rogers? Aye. Rogers, aye. Carrillo? Aye. Carrillo, aye. Flora? Gonzalez? Krell? Krell, aye. Patel? Patterson? Rodriguez? Sanchez? Sanchez, aye. Schiavo? Schiavo, aye. Sharp Collins? Stephanie? Stephanie, aye.
Thank you so much, Assembly Member.
Good evening, Madam Chair and members. Thank you for allowing me to present Assembly Bill 645. I also want to recognize Julia Muad in the office for her work on this bill. Really appreciate the work that she did on this bill. And then I just want to start by accepting the committee's amendments. I appreciate the committee staff's work on this bill, and I believe the amendments help us better meet the intent of the bill. This bill seeks to improve emergency medical services by requiring public safety dispatchers to complete emergency medical dispatch, or EMD training. Dispatchers are often the first responders to the first voice a person hears in a life or death emergency. We owe it to Californians to ensure those voices are trained and equipped to save lives. Currently, California has no statewide standard for dispatchers training. While some jurisdictions require EMD certifications, many, especially in rural areas, do not have that. That means a person's chance of receiving life-saving pre-arrival care can depend on whether they live or not, and that is unacceptable. In cases of cardiac arrest and other life-threatening emergencies, every second counts. According to the American Heart Association, immediate bystander CPR can double or triple survival rates, yet fewer than half of cardiac arrest victims receive CPR before emergency responders arrive. EMD training equips dispatchers with the tools to guide callers through CPR, the Heimlich maneuver, and other critical steps that can help save lives before help arrives. The studies shown that when dispatchers provide step-by-step instruction over the phone, bystanders are significantly more likely to perform these life-saving maneuvers. This bill is aimed at helping Californians help their family members, their friends, their neighbors when they're experiencing an emergency. Today I have with me Jimmy Pearson, California Ambulance Association board member and president of Medic Ambulance. Thank you.
Thank you, Assemblymember Carrillo. Good evening, Chair Bonta and esteemed members of the Assembly Health. My name is James Pearson. I am the president of Medic Ambulance Service, operates in 7 counties with 675 employees. Today I am here before you as immediate past president of the California Ambulance Association, advocating for our sponsored bill, Assembly Bill 645, a crucial piece of legislation that will require emergency medical dispatching for all emergency medical services calls. Every moment matters in an emergent situation. When a call for help is made, the seconds that tick by can mean the difference between life and death. Yet, all too often, callers are left without guidance they desperately need while waiting for emergency services to arrive. AB 645 addresses the urgent need by ensuring that every emergency medical call receives professional medical dispatching complete with pre-arrival instructions tailored to the specific situation. This requirement is not just beneficial, it is essential. Medical pre-arrival instructions empower laypersons to provide immediate assistance, whether it's performing CPR, managing emergency bleeding, or aiding someone who is choking. By equipping callers with the knowledge they need during those critical moments, we can improve outcomes and save lives throughout California. Moreover, establishing a proficient process for providing these instructions strengthens our entire emergency response framework. A cohesive dispatch process allows first responders to arrive on scene and be better prepared with vital information about the situation they are entering. Additionally, AB 645 promotes consistency in emergency medical dispatching statewide, reduces variations how communities respond to emergencies. In closing, the implementation of emergency medical dispatching for all emergency calls through AB 645 is a proactive step towards saving lives and enhancing the quality of emergency care throughout California. We believe it's a right of every Californian to receive these life-saving telephonic instructions when they call 911. Access to that care in every community is vital. And I thank you very much for your time today. Strongly urge your support. Thank you.
Thank you. Are there any others in support of this measure? Moved by Schiavo, seconded by Patel.
Good evening. Sean Sullivan with the California Ambulance Association and strong support. Thank you.
Thank you.
Eddie Stamp, NorCal Ambulance, strong support.
Hello, Ramit Sahi, NorCal Ambulance, strong support.
Alexander Armendariz with NorCal Ambulance and strong support.
Mike Dowd, Medic Ambulance Sacramento, in support.
Grady, Pro Transport 1 with support.
Suzanne Johnson, Medic Ambulance Sacramento, and I'm in support. Lisa Curley, Medic Ambulance, strongly support.
Thank you. Is there any opposition to this bill? You got a Kit Kat for your opposition.
Speaking of the health committee, did somebody drop their health food on the floor?
No one on this dais did. Absolutely not. Please go ahead. You'll have 2 minutes.
Thank you. Madam Chairwoman, members of the committee, Mark Smith on behalf of CalNINA, the California chapter of the National Emergency Number Association. We represent the voice of 911 dispatchers. While we did write an oppose unless amended letter on the bill, I want to revise that to say we do have some concerns about the way that the bill is proposed to be implemented. First, we do agree that the amendments that are proposed to be taken to exempt law enforcement from the mandates of EMD training is absolutely appropriate. So as an example, if you were to call 911 from this room, that call is going to go to a law enforcement dispatch center. Here in Sacramento, it's either going to go to Sacramento Police or Sacramento Sheriff. They're going to ask you what your emergency is. Is it police, fire, or medical? If it's fire or medical, it's immediately going to get transferred to an EMS dispatch center, so a secondary PSAP. Across the state of California, most of those secondary dispatchers are trained and have EMD certification. We believe as dispatchers that everybody that calls 911 should have access to the type of life-saving instructions that the sponsors of the bill just mentioned. Our concern is twofold. One, if you require law enforcement to do it, you're actually delaying the process of providing help because they're not going to triage the call, send emergency response out because they're going to be giving instructions over the phone. So that call has to be transferred to the right type of dispatcher to provide the over-the-phone instruction. The second thing is, we don't know whether we want this to be done at the statewide level or the local level. Right now, we're leaning towards the local level. And the reason for that is because there are already successful examples of regional collaboration at the local level where EMD offered dispatch is being provided to the entire community. And we don't want a statewide standard coming in on top of that might disrupt what's happening within local communities. The sponsors have noted the reason for the bill is that there seem to be places in the state where there are gaps where this training is not appropriately provided. We believe those are best addressed again at the local level. I have a couple other things I'd like to, if you...
And nope, your 2 minutes are up.
Okay, all right. So for these reasons, we remain concerned about the bill. We look forward to working with the author on the implementation. Again, we don't disagree with the notion, but we want to make sure that the policy is rolled out in a way that does not affect what's already happening well at the local level and can provide the services. Thank you.
Thank you. Is there any other opposition to this bill? Seeing none, I will bring it back to the committee for comment or question. Assemblymember Patterson.
Great, thank you. Just wanted to say I'm very interested in the concerns that were expressed, but in my town, when I was on a city council, if you called 911, notwithstanding CHP or a pickup like that, it went to our police dispatch. And I would hear often concerns about, maybe, and 70% of the calls or something like that, by the way, were EMS. And so it was something that was expressed concern with, hey, we could use additional training, from the fire side, for the police dispatch and cause a little, just to be honest, cause a little bit of, in some of the smaller cities, like, the police departments usually house the dispatch, and I think that's great. But I do think on the local level, we would like, to resolve it. But I am interested in what you're working on, and I'm going to lay off today only because I agree with that, where you're trying to go with this bill. But I do think there are some things that need to be worked out. The sheriff's office, for example, in Riverside pointed out something, and I think that there are amendments that might address some of those things. But just wanted to see if the training isn't necessary, or maybe the local governments already have something in place. Is that something you'd be willing to?
Absolutely, we're willing to work on the implementation. In fact, we can look for a list, working with the opposition to see where is it working well, what small communities, and we can continue to work on that to address those very same concerns. But if you want to add anything else.
Yeah, I just want to say, we have some communities, and I'll bring up Vallejo, where we provide 911 service, same issue, right? Fire and EMS, we don't really get EMD. They just get the 911 call, and they disconnect. And so when a baby's not breathing, that's not happening. And yes, you can have local policy. We have a local EMS policy for EMD, but it's not mandated, and there's nothing statewide that mandates it. And that's sometimes in Solano County, I'll use specifically, we've been dealing with EMD since 1989. Our EMS cooperative was even created in 95 with one of the charter issues of defining EMD, and here we are in 2025, hasn't been defined. And you have to be local politics of who housed that call. And so that's where this bill can really, I think, help guide that, right? And how do we get there? Because in underserved communities and rural communities, when we have a 15, 20-minute response, which is a good response sometimes in a rural community, and somebody's not breathing or choking, they deserve to get that call. And I've been a paramedic for 20 years, and I'm an EMD. And when you hear that call of a non-EMD center and an EMD center, especially when a baby's not breathing and choking, it's silence and it's deafening. And it's really, it's the standard that we need to provide for EMD.
Yeah.
So sorry about that. Just want to clarify.
No, I appreciate it. I mean, one thing I really appreciate about this bill is it's going to force a conversation that I think we need to, who knows what happens with the bill at the end of the day or what amendments you're going to have taken, but I think this is a really important conversation for cities where there's one dispatch, right? And I know that a lot of communities will ultimately, and counties will move to unified dispatch, I think, so that'll kind of change it. But yes, sometimes local politics in going to unified dispatch gets involved, right? So, but I think this could force the conversation ultimately. But I'm not quite there yet, but I hope, we can get there by the time we get to the floor. I think it's it's great to force the issue, and start having the conversation.
Majority Leader.
Thank you for bringing this forward. I'd like to be co-author if I'm not already.
Thank
I
you.
want to thank the men and women at the back of the room for what they do. And I think if we can give them any kind of tool to make their job better, to give trust to our communities, it's well worth it. So again, I'll be supporting the bill today.
Thank you.
Thank you. I don't see any other committee comments. Assembly member, you can close.
Well, as the opposition stated, the amendments we're taking today removes the law enforcement dispatchers from this bill. AB 645 will ensure that every 911 caller, no matter where they're in the state, receives the same quality of life-saving support. And with that, I respectfully ask for an aye vote. Thank you.
Thank you, Assembly member. And the amendments that this committee offered are going to be taken in emergency management should the bill pass out of committee. With that, we have a motion and a second. Please call the roll.
The motion is due pass to emergency management. Bonta.
Aye.
Bonta, aye. Chen. Addis. Aguiar Curry. Aguiar Curry, aye. Rogers. Rogers, aye. Carrillo.
Assembly member, are you voting on your own bill?
Carrillo.
Aye.
Carrillo, aye. Flora Gonzalez. Krell. Krell, aye. Patel. Patel, aye. Patterson. Rodriguez. Sanchez. Schiavo. Schiavo, aye. Sharp Collins. Sharp Collins, aye. Stephanie.